And now it is time for healthcare. Our get-together with Scott Curtis today from Kossuth Regional Health Center, our healthcare edition. Scott, good morning to you.
Good morning, Al. How are you today?
Oh, doing just fine. Now, usually when Scott comes out and joins us on the healthcare, why there's usually something. They usually have some type of announcement or something. There's usually something pretty special that we have Scott in to share with us, and I guess we do have that today. We're hearing commercials on the radio. I was watching TV the other night, saw some commercials, and it's like a new name. It used to be Mercy, but there's a new name, and that's what we want to talk about today.
That's exactly right. If you were watching the Super Bowl past Sunday, you saw the ad come on right after halftime for MercyOne. MercyOne, kind of a new image, new logo, new approach, and that's very much what we want to talk about. There's a question about how does that impact us here at Kossuth Regional Health Center. I think it's important for us to acknowledge that with this new name that Mercy's bringing out, it's going to help us and benefit us in many ways. But first and foremost, we're not changing our name here in Algona. We are still Kossuth Regional Health Center. We are affiliated with MercyOne, just like we've always been affiliated with Mercy for quite a long time, dating way back to 1986, when the first relationship was established with a management agreement between Mercy and the local hospital.
So, as you said, so it's not going to change the name of the center here in Algona. That'll still be Kossuth Regional Health Center. What changes will there be? And you said there'll be some benefits. So let's talk about the positive.
That's really the angle that we want to talk about with this. So the long-standing relationship continues, and what we're seeing is this relationship with Mercy just got stronger exponentially through their ability to create a much more clear identity of who Mercy is across the entire state of Iowa. Because there are many different locations that have been connected and affiliated through that network. By changing this name, now there's going to be that power of that brand. And for us in Algona, we're going to be able to leverage that relationship in many ways that otherwise without we wouldn't have the benefits of. Examples. As we go out and try to contract with all the different insurance companies to be a provider for them, MercyOne now is able to negotiate on behalf of Kossuth Regional Health Center, as we're affiliated with them, as they do with the 38 other entities that's part of MercyOne across the state. We're going to get a much better deal than we would have otherwise.
Okay, so strength in numbers, in other words.
Strength in numbers. Yeah. Trying to recruit. If we continue to try to recruit additional providers down the road, those individuals not only want to know what's that hospital in Algona and how do you pronounce that name, they're going to see affiliated with MercyOne. And just about anybody that's looking for a location in the state of Iowa is going to know who MercyOne is. It gives us the credibility to know that we're affiliated with a larger system that's already proven itself.
Yeah, so that they're creating a brand that will stand out, that will stand for something, for many. Your, of course, intent is to stand for many positive things.
That's exactly right.
Yeah. So MercyOne, I knew when I saw that, you answered some of my questions right there. When I saw the commercial, I thought, MercyOne. This is obviously what we thought of as the Mercy Network that Kossuth Regional is affiliated with, and that was my thought. I wonder if this changes names of our center, if it, what it does, that sort of thing. So, any other positive benefits that we're going to see outcome?
When you think about that power of MercyOne, there's 20,000 people that are employed and affiliated with that throughout the state. And we're going to be able to benefit from the good work and best practices that they do. So as they see things and benefit, we can replicate that and share in that. So we really are part of a very big system, even though we have our own independence and autonomy here in Kossuth County. So that's going to be a benefit. Even though you go over to Mason City, they're changing their name. So we're Mercy Medical Center North Iowa. They are now MercyOne North Iowa Medical Center, just as all these other locations that are owned by the corporation across the state will be. That's the other benefit for us, is having that identifier. So they'll all be using the same name and logo.
All right, so very, very good. So we'll see It's a name I'm sure we're going to be hearing a lot more of as in coming months, that type of thing. And by the way, that is Mercy, and it's the number one. Just in case you haven't seen the TV commercial, it's like Mercy and big number one. All right. Anything else for the day before we run out of time on this healthcare session, Scott?
Well, thanks for giving us a chance to talk about how we're being one together. I appreciate that.
Absolutely. MercyOne. And again, Kossuth Regional Health Center. Scott Curtis joining us today on our healthcare report from Kossuth Regional Health Center. And that is this update on your healthcare program.